Hello, my name is Dr. Ogechi Nwokedi. I'm currently doing my fellowship in Pediatric Optometry in the Indian Academy of Optometry. Today I'll be examining a 7-year-old school child who has come in for an eye examination. I'll be checking his visual acuities. I'll be doing external eye examinations to make sure his eyes are free from any pathology. I'll be doing refractions, and I'll be doing a spectacle dispensing if necessary. Hello. Hi, okay. So this child has complained, mom complained that he can't see things far away from him. He's having difficulty seeing the blackboard in school. He's also going very close to the television to see. He's never had any eye examination before. This is his first eye examination. His father wears glasses for short-sightedness, according to his mom, and he has no known allergies. His birth history were unremarkable. He was born full-term baby, normal delivery, and he has no complaints apart from blurry vision at far. Okay, so I'm going to use these special glasses. Okay, there are 4 glasses you can see. One eye is covered, and you're going to read through with the eye that is not covered. And then I'm going to do the same thing with the other one. Okay, I'm going to put them online, and then you read for me what you see on our chart. So that is nearly chapter 10.
D Y.
Very good.
F.
Very good.
W.
Good.
G.
Yes.
J. E.
Very good.
G.
Good.
C. T. O.
Okay. Can you read the other one?
No.
You can't? You can't try? It's not very clear? You can't see very well? It's not very well. Okay, so we're going to try and do the same thing with the other eye, okay? So you're going to read for me. I'm just going to change the alphabets now. And you're going to read for me from the top, okay? Let's see what you can read. Okay, can you read, please?
F. W. N.
Good.
E.
Good.
P.
Good.
G.
Good.
X.
Yes.
O.
Very good.
Q.
Yes.
H.
Yes.
I.
Good.
Z.
Good. Can you try the next line? Can you see? It's not clear. You can't see it. You can't see it very well. Okay. That's alright. You're doing very well. Okay, so I'm going to take this off, okay? Now, he's not been able to read further than the 618 line. So I'm just going to be doing a pinhole assessment to see if you can see a bit better. So I'm just going to put these special glasses on you, okay? And then I'm going to have you have one eye covered, and then there's a tiny hole. There's just a very tiny hole. You're going to read through the tiny hole for me. Can you see anything through the tiny hole? Okay, can you read for me from the top? Good.
F.
Good.
W.
Yes.
N. E.
Good.
P.
Good.
G.
Yes.
X.
Good.
O.
Good.
Q.
Yes.
H.
Yes.
I.
Yes.
Z.
Good. Go on.
W.
Yes.
N.
Yes.
I.
Yes.
Z.
Yes. Can you see? Good.
C. T. K.
Can you see any other one? You can't see any other one. Okay, so we're just going to try it on the other eye, okay? And then you're going to read for me again, alright? Can you start it fresh again?
C.
Good.
C.
Good.
K.
Good.
F.
Good.
M.
Good.
D.
Good.
Z.
Yes.
Q.
Very good. Go on.
X.
Good. Good.
D.
Good.
P.
Good.
T.
Good.
I.
Good.
I.
Mm-hmm.
F. Z.
Good, good. Can you go further? You can see. Okay, so he's been able to read, there's some form of improvement with pinholes. So he's been able to improve from 618 to about 69 with pinholes. So this is looking like a refractive case to me. Okay, so I'm just going to see what you can read, okay, for me. Okay, so this is our near chart, so I'm going to do the same thing. You're going to read for me again. I'm going to do it eye by eye. So I'm just going to get you to read from the last one, okay? All right, can you read the last one, please?
Look who I found. Whispering under the shore in water.
Good. Keep going.
She said it was a
Right.
surprising part with his little tail between his legs.
So that is very good. So he's been able to do the N5 line without any difficulty. So he's just having difficulty seeing things that are far away from him. So now I'll just be doing a refraction. I'll be doing a retinoscopy first, and then I'll put on the glasses again. This one. Okay? Keep looking at that big letter T. Can you see that letter there? Looking through. So the retinoscopy shows that this child is bit myopic, short-sighted. So I'm just going to do a subjective refraction to see if we can get him to see a bit better. So we are going to be putting some glasses on. Please, can you read for me from the top? Can you read for me from the top what you see? Can you try?
C
Yes.
P
Yes.
F
Yes.
M
Yes.
P
Yes.
Z
Yes.
Q
Yes.
X
Yes.
O
Yes.
J
Yes.
V
Good.
H
Good.
D
Good.
P
Good.
G
Good.
I
Yes.
I
Very good.
Z
Good.
Q
Good.
H
Look at this one. Is it a bit better? Can you keep reading?
S
Good.
J
Good.
A
Yes.
R
It's making it better? Okay, good. Can you go on? Can you see a little bit more? You can't see a bit more than that. Okay. Does it help out a little bit? Can you see a little better than that line? Can you read? That small line. Very good.
U
Good.
K
Yes.
E
Very good. Very, very good. You've done so well, okay? So I'm just going to do the same thing for the other eye, and then I'm just going to put some glasses in, and you're going to help me read for you what you see, okay? Okay? So can Can you go from the top?
C,
Good.
T,
Yes.
K,
Yeah.
F,
Mm-hmm.
N,
Mm-hmm.
D,
Good.
Z,
Yes.
Q,
Yes.
X,
Good.
O,
Good.
J,
Yes.
V,
Good.
H,
Mm-hmm.
D,
Fantastic.
P,
Yeah.
D,
Very good.
I,
Yes.
R,
Yes.
Z,
Yes.
O,
Good.
S,
Good.
J,
Yes.
A,
Yes.
R,
Good.
D,
Good.
U,
Good.
K,
Good.
E.
Good. Does it make it a bit better than before? Just a little bit. Does it make it a little better? Let's look at it now. Look at it. Does it make it better? Can we read a little bit? Mm-hmm.
N,
Mm-hmm.
E,
Good.
V,
Yes.
H,
Very good. Very, very good. I'm just going to remove both eyes now. Okay? Just sit. Keep your head straight. Okay? And keep looking straight. Make sure that you're looking at it. Okay. You see very well now. See a bit clear? Is it clear? It's clear. It should be clear. Can you see a bit better? Are you from the top?
C,
Mm-hmm.
T,
Mm-hmm.
K,
Yes.
F,
Yes.
F,
Yes.
D,
Good.
Z,
Mm-hmm.
Q,
Mm-hmm.
X,
Yes.
O,
Yes.
K,
Yes.
V,
Yes.
H,
Yes.
D,
Yes.
B,
Yes.
G,
Good.
I,
Yes.
I,
Yes.
C,
Yes.
Q,
Good.
S,
Yes.
J,
Good.
A,
Yes.
R,
Very good.
B,
Very good.
U,
Good.
K,
Yes.
B,
Very good. So he's improved a little bit, much more than before. I'm just going to change it one more time to the other alphabet, okay? So you're going to read this. Can you see what this line is pointing at? Can you read that one for me if you can?
W,
Good.
E,
Yes.
J,
Yes.
A.
Very good. So we finished the refraction. Found out that this child is short-sighted, is myopic of about -2 on both eyes. So I'll be dispensing this after the other examinations that I'll be doing. So I'll be doing an external eye examination now. I'll be looking at his at the front surface of the eye. So I'm going to be looking at his eyelashes. I'm going to be looking at his conjunctiva. I'm going to be looking at his cornea. I'm going to be looking at his pupil to make sure that the pupils are reactive to light and accommodation and no RAPD present. I'm also going to be able to just make sure that his motilities and eye movements are okay and has no eye deviations. So here goes. So I'm just going to be using this torch to shine on your eyes, okay? It's not painful, okay? Just for me to make sure that your eyes are healthy, all right? Okay, just keep looking straight. Let me looking at your eyelashes. Can you close your eyes a little bit for me? Just close it. Good, good. Okay, so his eyelashes are very in position. He has no eyelashes that are turning inwards. There are no cross on his eyelashes. He has no signs of blepharitis. Eyelashes are clean. They are well positioned without any signs of cross or discharge from his blepharitis. Look up to the ceiling. Okay. Very good. Look down at your legs. Look down at your finger. Thank you. Okay. Look down at your finger there. Thank you. Very good. Look up to the ceiling, like you're looking up to the sky. Very good. So look straight at the alphabets there. You just look at the eyes. Okay. Open your eyes wide. Open your eyes, big eyes, big eyes, big eyes. Both eyes should open. Keep your eyes looking straight, looking straight. Okay, big eyes, big eyes, big eyes, big eyes. Keep your eyes wide open. Very good, very good, very good. So I'm going to move this light around and I want you to follow it. I want you to follow it without moving your head, okay? So I'm just going to have you look around. Just look at the light and I'm holding it. Very good. Look at it. Very good. You're running faster than my light. Just keep looking at the light, okay? Without moving your head. Okay? Keep looking at it. Good. Look at the light where it moves. Very good. Look at it. Excellent. Look at it. Well done. Okay, keep looking at it. Very good. Look up. Good. Look down here. You have to look where I'm showing. Don't look faster than the light. I want you to follow it. Okay? Is it funny? It's funny. Some eye tests sometimes can be a bit funny. But we all want to make sure that your eyes are moving right and the eyes are working together as a team, okay? So because two eyes have to work together, alright? So the eyes are good. The external eye examination shows that his eyes are free of pathology. His pupils are round, equal, and reactive to both light and accommodation, both in the direct and consensual reflexes. He has no RAPD, and his corneas are clear. It's clear. He has nice brown eyes, and his eyelashes are all clean and clear, healthy, with no signs of blepharitis or any conjunctivitis going on. So the other test, there's some other tests that we could have done for him, because for school children, I would be doing a color vision testing. I also would have done a depth perception test for him. Some other things that we need to I would be doing will be checking the back of his eyes and doing an ophthalmoscopy to make sure that his fundus is without any abnormality. So I've finished my test and I'll be doing the spectacle dispensing. He requires glasses for myopia. So the first thing I'm going to be doing is you're going to be looking at glasses, and I'll just talk to your mom a little bit about what we found out today. You're going to be wearing glasses, Shay, okay? Alright, the glasses will help you to see things that are far away from you, because mom said that you've been complaining you can't see things that are on the blackboard, isn't it? So we've done an eye test today, and we found out that you see that those glasses, when I gave you those glasses, can you see that? Remember that when I put the glasses on, can you see now that how you are seeing? You can't see too well. You see that these glasses helps you see a bit better? Can you see you can see a lot better with it? Oh, so you're happy? Are you happy? Are you happy? Give me five. Alright, good. So the glasses will make you see a bit better and will help you when you're working in the classroom, okay? So when you go to school, you have to put on your glasses, okay, to see things that are on the blackboard. When you're watching TV, you will need to wear the glasses as well to help you. And when you go to the movie house, you have to wear the glasses, okay, so that you can see a bit better. Alright? Okay, so the other things that we're going to do is Mom, he requires glasses. Okay, he's short-sighted. It's what we call myopia. So he requires glasses to see things that are far away from him. Okay, so please, the glasses is important that he wears his glasses. I know you didn't want to hear he needed glasses, but that's what he needs. Okay, so the glasses will help him to see a bit better. Okay, I also want to advise you about reducing screen time, because sometimes most of them are on the computers a whole lot. So I want you to reduce some screen time. You can go on the computer, but you have to monitor it and let him take some breaks. I also encourage you to take him out every day, at least to have do some walks or sports or ride a bicycle outside without any of the gadgets, okay? But that can help him also, because it's myopia at 7. You don't want, because myopia has a tendency to increase as the child is growing. So we are going to be trying to do things to make it not increase so fast. Okay, so today I'm just going to be looking at, we're going to be looking at a few frames. It's very important that with pediatric dispensing is very, very important, because with pediatric dispensing, what happens is that it's not the same thing as adult dispensing. The adult dispensing is a lot different, because with children, the facial features are still developing, the anatomy is still developing. So it is important that we pick the right frames, and it's important that we do the right lenses. It's important that the frame size, we are looking at the frame size, we have to look at the nose bridge, because most of the children are born with a low crest height, and also, we also have to look at, because for us to get a very good fit, we have to look at the length of the temple, make sure that the temple is long enough and it fits well. Cable temples are usually better for children, but when that is not available, we can always use spectacle cords and bands to secure the frame. So the nose bridge is very important, because children normally are born with, sometimes even when they're very young, with a zero nose bridge, which eventually continues to develop over the years. So it's important that we look at that, and also it's important that we look at the lenses, so that we give them lenses that are impact resistant, lightweight lenses. Like I prefer to give them the polycarbonate lens or Trivex, because it's lightweight, it's impact resistant, it has a additional UV block, and also the child's everyday rough and tumble, especially for a young boy like this, he may be breaking his to avoid breakages. So I'm just going to be putting on the glasses. It's very, very important. We are looking at nose bridge, we are looking at the temple, because the children, we don't want the glasses slipping off from his nose or slipping down his face when he's wearing them. And he has to like the glasses as well. Okay, so I'm just going to get the frame for you. Mom, do you have to come and help me with selection? And you also tell me what you like, okay? So there are so many glasses we have here. I want you to look at them, okay? So let's look at this. That's a nice mirror for you to look at, okay? You can see yourself. And then I'm just going to bring a few glasses for you to try on. Do you like this one? You don't really like it? You're not too sure? Okay, let me see. It's a bit too big for me, because you're looking at the bridge. So the bridge is very important for a good fit for children. Let's look at this one. Okay, let's see here. And looking at the temple, length is a bit too long. Most children have a very small lenticular bend, so you have to take that into consideration, so that they have a perfect fit and the glasses are comfortable. And it's important that the children also like their glasses, so fashion is also important. Do you like this one? Can you take a look? Okay, so you can see that this one fits nicely behind his ears. It's not slipping down his nose, and he likes it. So we are going to be using this to fit your glasses. Some other things that we are going to be doing is that we're going to be teaching you how to care for your glasses. Okay? So now that you're going to be wearing glasses, there is something called a spectacle case. Okay? So we are going to, this is for like a box that you use in storing your glasses when you're not wearing them, okay? So can you remove them from your face and good, you did it very well. So you with two hands so that you don't spoil them, okay? This frame also has a spring, it's also spring loaded, which is also very, very helpful for children. It's a plastic frame, the frame size is good, it's not too big, so that, and then because that is a good consideration, especially if the glasses, the prescription is high, then it is lightweight. You're giving lightweight and impact resistant polycarbonate lenses. and spring loaded. It's a spring hinge, so it also helps to protect additional protection for his glasses when he's pulling them out. And then you store them here, and there's something like this inside your. You have a Spider-Man zone. You like Spider-Man? Okay, good. So this is for you to clean your lens before you put them on. It's called a microfiber cloth. Okay, so you clean it and you store it in here. And then I'm going to add something special for you. This is a spectacle cord. Okay, the spectacle cord, you can use them to protect your glasses from dropping when you're putting them on. So you have the spectacle cords on. Okay, so that's where you put them in, and when you're wearing them, you put it on. Oops, let me help you. Okay, let's just see. Spectacle cord goes in here. You have the spectacle cords behind your ears. Mom, are you watching? Yes, no. Okay, so you can do it himself anyway. It's a big one. Okay, and when you're not wearing your glasses, you can drop them on your neck. Okay, all right. So that's your glasses. So you think what we're going to do is like in 6 weeks' time after you've gotten your glasses, I'm going to take the frame away today, and then you're going to get it in a few hours from now, because it needs to go into the workshop for them to cut the lenses to shape on the frame. Okay. So when we get them, after he's worn it for 6 weeks, we're going to see him to see how he's adjusting to the new glasses. And then after that, I might be seeing him every 6 months. Okay? So he's fine. So you think you can do this? Excellent. Okay? So good. So give me high five. You've done super well today. And you take your glasses off now. Let's put this off. And then we're going to put this in the box. And it's going to go to for them to put your lenses inside. So one will come and pick it up later. Okay? Alright? Thank you very much for being with me today.
Thank you,
I'm also going to show that we've stored this, we've recorded everything on the file. So the file is here, everything we're going to do is on this file. Okay? So, and I'll be seeing you in 6 weeks. So, you want my sticker? You've done so well today, so you deserve that. What do you want? Mr. Incredible? Which of them you like? Okay, super incredible, excellent. What do you want to put a sticker? Fantastic. Okay, so give me 5. Well done, well done. Thank you. So see you. Thank you, ma'am. Thank you.